Right now, I want to welcome to the program from Doctors for Responsible Gun Ownership. Dr. Robert Young is with us. Dr. Young, thanks for your time today.
Good afternoon, Cam. How are you all?
I am good. It's good talking with you again. And we all saw this tragedy last week. A doctor shot and killed at Brigham and Women's Hospital in Boston, Massachusetts. And the Harvard Crimson, shortly thereafter, Doctor, had an op-ed in which they referred to this crime as one of the reasons they said that Massachusetts needed more gun control laws. Now, they even acknowledged that they couldn't think of a gun control law that would have prevented this crime, but they said that this still should be that sort of jumping off point for a discussion about more restrictive laws in Massachusetts. I'm just curious your take on this, because you wrote about this murder at Doctors for Responsible Gun Ownership.
Right. Well, regarding the Harvard Crimson, I'll have to look at that, because at least maybe it's an example of somebody on that side of the debate at least being honest about why they're on that side, which is because they just can't think of anything else.
Perhaps that is the case, because if the editorial writers of the Harvard Crimson had happened to read the blog there at Doctors for Responsible Gun Ownership, they would have seen your thoughts, and you reminded us of an incident that happened last year in Philadelphia, where another doctor was meeting with a patient and was attacked. But this doctor was able to defend himself.
Yes, which we also talked about on the show at one point. And I also wanted to remind people of a couple of other incidents, too. A psychologist was killed at a VA clinic last year by a client. And in 2013, just 2 years ago, a physician shot in his own exam room in California. These things do happen. Healthcare, interestingly, is one of the more dangerous professions to work in. I wouldn't compare it to that of the police or firefighters, but compared to anyone else, our risks of being hurt in violent incidents by almost exclusively unhappy patients or their families are quite high. Compared to anyone else. They may be almost 4 times as high as the same sorts of incidents occurring in private industry. As these examples show that we're discussing, they can happen anywhere, and particularly, I believe, we're at risk in the places we work. They're supposed to be places of retreat and solace for folks. But when someone doesn't feel that they've responded that way, and they're responding the opposite way, they also can become death traps for folks who are caught in an office with no way to defend themselves.
Doctor, is this I know, for instance, a couple of months ago, there was a story of a realtor in Arkansas who was abducted and murdered as she was showing a house to somebody. And I remember talking with a lot of realtors on the program afterwards about how this had prompted a real discussion among realtors of, should you carry a firearm? What should you be able to do to protect yourselves? I'm wondering if we're having a similar discussion within the medical community right now.
Well, you and I are. I guess if I count as the medical community, we are. And of course, I know some other docs who would feel much happier doing that, and there are certainly docs across the country who are in fact doing it. That's of course the beauty of concealed carry in our society. But no, as a medical profession at large, having this kind of discussion, well, no, of course not, because the medical community at large, as spoken for by organized medicine, is clearly on the side of gun control and has been for 20 years. So one of the things the Doctors for Responsible Gun Ownership and some other more conservative medical organizations are trying to do is to have that discussion, whether anybody wants to have it with us or not. I think something else worth remembering for our entire audience, too, though, is that the organizations that constitute organized medicine, the specialty societies, only can claim a fraction of their specialty physicians as members. The AMA, where I recently went to make a presentation of the good reasons for the Firearms Owners Privacy Act in Florida, may have 20% of American physicians as members. Other specialty societies, like my own, the American Psychiatric Association, is comparable. So when we hear about the position of medicine on a subject, what we're really hearing is the position of the leadership of organizations that themselves include a small fraction of all the physicians who ought to be heard. So we want physicians who disagree on this point to be heard, and that's why we speak up.
Well, listen, we appreciate you speaking up, Dr. Young, and thank you so much for coming on the program today. It is always a pleasure getting a chance to talk with you.
And mine, Cam. I'll take care, and best wishes to everyone.
You too, sir. We'll talk again soon. Dr. Robert Young with Doctors for Responsible Gun Ownership.